Hello all, I'm Divya and my today's topic is blood disorders. So blood is important component of life. Blood disorder can be caused in three main component of the blood. So very first is RBC that carry oxygen to the tissues of the body. Then second is WBC, it helps in fighting against infection. And third is platelet, these helps in blood to clot. So blood disorders can also affect the plasma of the blood in clotting. So treatment and prognosis of this blood disorder depends upon the severity of the blood conditions or blood disorders. So very first is the blood disorder related to the RBCs. So first is anemia. So people with anemia have a low number of RBC. So mild anemia cause no symptoms, while there is more severe anemia that can cause fatigue, pale skin, or shortness of the breath with exertion. And then comes an iron deficient anemia. So in iron deficient anemia, iron is needed to make RBCs, and low iron intake and loss of blood due to menstruation, or blood can be lost due to ulcer or some cancer. um, Cancer of GI tracts. So due to this loss of blood, um, it loss of blood, uh, it can cause an iron deficiency anemia. So the pills that include iron pills or is required to prevent this, and also sometimes blood transfusion. So the third one is anemia of chronic diseases. So people with chronic diseases like chronic kidney diseases or other chronic diseases develop this type of anemia. It does not require treatment, but injection of synthetic hormones like epoetin alpha, also called as epogen or procrite, is required to stimulate the production of the blood cells, or blood transfusion may be required to cure this anemia. uh, in some people uh, in some people with this form of anemia, blood transfusion is required, not all. Then the fourth type of anemia is aplastic anemia. Aplastic anemia is caused due to the RBC production that is not happen in bone marrow. It is caused by lot of things, like bone marrow does not produces enough RBC cells. It can be caused by hepatitis, or because of Epstein-Barr or HIV, or the side effect of the drug, or due to pregnancy, or due to chemotherapeutic medication. So in aplastic anemia, RBCs are not well produced, so medication is required for this thing. So medication is required, or blood transfusion is required, or even bone marrow transplantation may be required to treat this aplastic anemia. Then the next one is pernicious anemia. Pernicious anemia is due to the B12 deficiency in a blood. So it is a condition in which body does not absorb enough B12 vitamin. So this can be caused by weakened stomach lining, or autoimmune condition. So beside anemia, nerve damage can also be happen due to this. So the high doses of B12 vitamins can help to prevent this disease for long term problem. Then comes autoimmune hemolytic anemia. So in this overreactive immune system destroy its own body cells, that can cause anemia. So because of the destroy because they destroy their own body cells, RBC level drops, so that causes the anemia. Medications that suppress the immune system, that is like prednisone, can be given to the patient to stop the process to stop this process of overreactive immune systems. Then comes in thalassemia. Thalassemia is genetic disorder or genetic form of anemia. It mostly affect the people of Mediterranean heritage, and most of the people have no symptoms of thalassemia and they require no treatment, but some may require regular blood transfusion to reduce this anemia symptoms. These anemia symptoms. And then sickle cell anemia. In sickle cell anemia, it is also a genetic condition. This condition most oftenly seen in Africa, Central or South region of America, India, and then the Caribbean islands, Saudi Arabia, and Mediterranean countries like Greece, Italy, or Turkey. In this sickle cell anemia, the RBCs get sickle in shape and they are sticky and stiff. Because of that, they can block the blood flow and can cause severe pain or damage can occur to the body. Then comes polycythemic vera. In polycythemic vera, body produces too many blood cells, and they and it is unknown why it is caused. So excess of RBC generally create no problem, but there are chances of blood clotting in some people because of this. Then comes the malaria. In malaria, mosquito bite and transmit a parasite into the blood's RBC. So periodically, RBC cell ruptures because of this and causing fever, chills, or organ damage. This is all about the conditions or disorders caused to the RBC. The next is disorder caused to the WBC, that is white blood cells. So the very first is lymphoma. Lymphoma, blood cancer. It is a blood cancer that develops in lymph system. So in this, WBC become malignant, multiply abnormally, and spread abnormalities. So it is there of two types: Hodgkin's lymphoma and non-Hodgkin's lymphoma. These are two major groups of lymphoma. So treatment with chemotherapy or radiation can extend the life with lymphoma, or also can cure it. Then comes a leukemia. Leukemia, it is also one form of blood cancer that become blood cancer. In this, WBC become malignant, multiplies inside the bone marrow, and leukemia may be acute, that is rapid and severe, or it can be chronic, that is slowly progressive leukemia. So chemotherapy or stem cell transplantation is required to cure this leukemia. Then comes a multiple myeloma. Multiple myeloma has no cure. It is a type of blood cancer in which WBC cells called plasma cells become malignant, and the plasma cell multiply rapidly and release a damaging substance that can harm organs or damage the organs. So stem cell transplant or chemotherapy allow the people to live with this condition for some extra years. And then comes a myeloid. Then comes myelodysplastic syndrome. In this syndrome, the family of blood cancer affect the bone marrow. So it develops slowly, but once it started developing, it can be developing fast, then it can be severe, and it can cause leukemia. So treatment like chemotherapy, radiation, or stem cell transplant is required to cure these diseases, and cure these diseases. Then the next is blood disorder related to platelets. So very first is thrombocytopenia. Thrombocytopenia is the production of low number of platelets in the blood. So it can be idiopathic thrombocytopenia purpura. So it is a condition that causing persistently low number of platelet in blood due to some unknown reason. So usually there are no symptoms of this idiopathic thrombocytopenia. So abnormal, um, it is abnormal condition, and there is no symptoms, but small red spot on the skin or abnormal bleeding can result because of this condition. Then comes a heparin induced thrombocytopenia. So in this, a low platelet count caused by the caused due to the reaction with due to reaction with due to reaction against heparin, blood thinner is given to many hospitalized people to treat the blood clot. So this is about heparin induced thrombocytopenia. It is caused due to heparin. And then comes this thrombotic thrombocytopenia, penic purpura. So it is a rare blood disorder. It causes small blood clot in the blood vessels throughout the body, and platelets are used up in this process to lower the platelet count. Process that causes a low platelet count. And then comes essential thrombocytosis. It is a primary thrombocyto. It is a cyto. It is a primary thrombocytosis. So the body produces too many platelets due to unknown reason, due to unknown concern. The platelets do not work properly. It produces the platelet that doesn't work properly, that result in the excessive blood clotting, bleeding, or it can cause both blood clotting or bleeding. So this is all about the blood disorder related to the platelets. So the next one is blood disorder related to the blood plasma, or the blood disorder that can affect the blood clotting. So very first is hemophilia. So in hemophilia, hemophilia is it is caused due to genetic deficiency of certain proteins in the blood. So these proteins helps the blood to clot, but because of this deficiency it is hard to clot the blood. So there are multiple forms of hemophilia, from very mild to the life threatening. Then comes von Willebrand diseases. Von Willebrand diseases, it is a factor, or it is a factor. It is a protein in blood that helps the blood to clot. So in this disease, body either produce too little protein or produce a protein that does not work properly. So it is inherited condition, and symptoms can be excessive bleeding after injury or after surgery or during surgery. Then comes a hypercoagulable state. So in this tendency of blood to clot become too easy, means blood clot so easily. So most of the affected people have a mild excess tendency of the clot, and many can never be diagnosed. So they require blood thinning agent to cure these diseases. And then deep venous thrombosis. It is a thrombosis or a blood clot in a deep vein, usually in the legs. So it dislodge and travel through the heart to the liver and cause a pulmonary embolism. So this is all about the blood disorders. Thank you.